We begin the second portion of our program with a series of reports on Asia. In 2008, Vietnam passed the National Health Insurance Law. However, although it is a national plan, some of the conditions and benefits are not ideal, especially when compared to Taiwan's health insurance program. Basically, the Vietnamese government divides society into groups such as laborers, retirees, elderly, young children, students, and the poor. There is only compulsory insurance for laborers, meaning that 30% of Vietnamese people are not insured.
Some believe they're quite fortunate to see Taiwanese doctors in Vietnam who can speak Mandarin.
会选择去哪里看医生？
他是找台湾医生。
你有去过他这里的诊所看病？
没有，我们是自己会带一些感冒药过来。每一个人都是这样，不是有。
Those working in Vietnam may be afraid of seeing a doctor. At the moment, some 100,000 Taiwanese are working in Vietnam, with many complaining about the closed nature of the medical industry. At the moment, some 5 clinics are now operated by Taiwanese.
In February, I came and took a look and felt that this area really lagged behind in medical care. I thought it would be really hard to open a clinic, just like Master Zheng Yan must have experienced opening a clinic in Hualien at the time.
5 years ago, Mr. Huang, at the invitation of China Steel, came to Vietnam with a few friends to open a clinic in this industrial area. He was the first Taiwanese to receive medical license to operate. He's the most important link to more than 1,000 Taiwanese businessmen and staff working in Vietnam.
He came last week and told me about his pain. He has kidney stones, but he is very busy, so he has no time to go home to Taiwan.
However, this clinic can only provide limited treatment. Those who are sick generally need to buy a ticket to go back to Taiwan. Many overseas Taiwan staff know this, and in addition to the medical insurance they have in Taiwan, they also are aware of the poor level of Vietnam's medical quality and care. This is the largest public hospital in Ho Chi Minh City. Has an overcrowded waiting room with many sick people in the hallway, corridors, and even the stairwell. It's a very disheartening scene. The hospital wards are even worse.
This is the best hospital in southern Vietnam based on medical technology, so many people want to come here, and many people have been accustomed to coming here.
Overseas Taiwanese heard rumors that one hospital bed may actually sleep 3 people, with the seriously ill sleeping on top and those less sick sleeping below. According to data, Vietnam has just 2.1 hospital beds for every 1,000 people, which is quite limited. Vietnam's major hospitals have been impacted by the implementation of a National Healthcare System Act in 2008, leading to a compulsory health insurance system. All workers are required to be part of the system, and the poor and children under the age of 6 qualify for full subsidies. This means that up till now, coverage is around 82%. Medical institutions are divided into 4 classes, with citizens who bought health care required to visit designated hospitals. Going to private hospitals or clinics is not covered. Those in remote areas frequently see small illnesses become a major problem.
Private doctors are more convenient. I have medical insurance, and if the disease is more serious, then I use medical insurance and save on medical costs.
The disparity between rich and poor is quite evident, as some Vietnamese cannot afford to pay for insurance, and these medical resources are still inadequate. For Taiwanese who are better off, they can go to foreign-invested hospitals, though a language barrier exists, along with higher costs and other problems that could cause some complications.
Going to these foreign-invested hospitals can be very expensive. How much does it cost? Spending one day in such a hospital could cost at least $300.
To improve Vietnam's medical standards in recent years, the government has encouraged foreign investment in the medical market, which is something that Taiwanese have long awaited. brand new white building is very eye-catching. It's the University Medical Xingmark Hospital, which is the first hospital invested by a Taiwan company. It was completed in May this year and opened in July. A tour of the facility sees a big new reception hall, new beds, and medical equipment. Local Vietnamese medical staff are quite impressed.
The equipment here is very advanced, and much of it is automated.
那手术灯是台湾的，手术台、手术灯都是台湾来的。对。有没有请张机的人来帮你们？是他们列出的规格吗？对，他们有帮我们看过，所以一切符合台湾标准。对。
In cooperation with Zhanghua's Christian Hospital in Taiwan, this new facility can accommodate a total of 1,600 beds. It's very rare for a foreign-invested hospital in Vietnam to operate on such a large scale. But this hospital is invested by the Xingmark Group, who has been in Vietnam for more than a decade manufacturing furniture. It's the first time it became involved in the medical industry, with a total investment amount of around $300 million.
We are hoping to invest some of the money that we have made from the manufacturing sector here and invest it here. I believe that this will help Taiwan as well as Taiwan's hospitals and the people of Taiwan. It will also be good for Vietnam. This piece of land and this building are built on the space that used to store shipping containers, which the government gave us to use.
Chow stressed that this investment case was green-lighted by the Vietnamese government, who provided vital local support. It gave them essential land concessions and also a 13-year duty-free operations. Chow was quite grateful for this support and looks forward to the introduction of more high-level medical technology and services in the country to benefit all of the Vietnamese people. Also, this sort of investment also better serves Taiwanese businessmen.
We hope that Taiwanese businessmen, our own overseas compatriots, can have the most reasonable price for medical services. We don't want to specially earn money by charging them for every little service. This is not our intention.
The most special thing here is the president of this company, as this hospital is really built on a grand scale and has top quality medical devices. Furthermore, the prices charged for medical service are very much like that of a public hospital.
With the economic growth of the Vietnam economy, along with the aging population, there will be increased demand for medical services. Vietnam in the past strictly controlled its medical industry, though it now has relaxed this policy, becoming more and more open. According to statistics, the amount of money that Vietnamese people spend every year on medical treatment overseas is around $1 billion.